Bobby Scott from Education and Workforce.
Thank you, thank you, Leader Pelosi and other colleagues. I want to thank the doctors, hospitals, health advocates, all in the public for following the debate and having their voices heard. The debate was an interesting debate because rarely did you hear anyone try to talk about the provisions of their bill. You heard complaints about the Affordable Care Act, but you heard nothing about how the bill was either better or worse than the Affordable Care Act, when the public, the doctors, the hospitals, and advocates noticed that on just about every count, their proposal was worse. 22 million fewer people insured. Others would pay more and get less. The insurance policies would cover a smaller percentage of the actual bills. There were no essential benefits. The caps would return, where they could cut you off after they spent a certain amount. You pay more, get less. 22 million fewer people insured, and the public noticed, and their voices were heard. Our colleague from New York and others have pointed out that this may not be the end. The House bill was withdrawn, and then a few days later came back and was passed. And so we have to remain vigilant. But we commit to work to, if they want to improve the Affordable Care Act, we're willing to work together to improve the Affordable Care Act, to make improvements. But so long as they are trying to go backwards, we're not going to help them go backwards. We're not going to take a bill that where 22 million people lose their insurance and compromise. Can't we all get along? Let's make it 11 million people that lose their insurance. No, we're not going to go backwards. But we will work together constructively to improve the Affordable Care Act, and I want to thank our leader for her commitment along those lines. Ms. Pelosi.
Thank you very much. Thank you.